We're back now with NBC5 Responds and the future of a federal rule to keep medical debt off of credit reports. It was supposed to take effect in just a few days.
But that timeline is in limbo right now because of President Trump's efforts to streamline the federal government. PJ Randhawa explains.
A federal ruling by the Consumer Financial Protection Bureau that would eliminate medical debt from credit reports was slated to go into effect on March 17th. The ruling also included old medical debt.
The KFF research, we found that people with medical debt are more financially vulnerable. They're more likely to go without food or go to their friends and family to request financial assistance.
Critics say scrubbing credit reports will make borrowing harder for low-income Americans and cause lenders to impose higher interest rates. But Senior Health Research Policy Manager at the nonprofit KFF, Lynn Cotter, says it's not that simple.
This doesn't clear the debt. People still owe this debt, and that's about 15 million Americans owe $50 million in medical debt. The evidence has shown that people with medical debt continue to pay it, whether it is or is not on their credit report.
Now, with the Trump administration ordering all work and litigation at the CFPB paused indefinitely, Cotter says the future of the ruling is uncertain.
The detractors, people who oppose the rule, and several agencies that have lawsuits against the CFPB have highlighted that they believe the CFPB has overreached and that it doesn't have the legal authority to remove this from the credit report, and that it could impact the bottom line for hospitals if they're not getting their payments.
KFF data shows healthcare costs are already increasing 7% annually, and Cotter adds they'll likely continue to do so. Regardless of the future of the federal ruling, Illinois is now one of several states that have taken steps to forgive medical debt and keep it off credit reports. In 2024, Illinois Governor J.B. Pritzker signed a law to keep all medical debt off consumer credit reports, but it does not include debt charged to a credit card. Pritzker also signed the medical debt forgiveness bill, dedicating approximately $10 million in state funding to erase an estimated $1 billion in outstanding medical debt. The law only applies to qualifying Illinois residents with a household income at or below 400% of the federal poverty level.
PJ Randhawa, NBC5 Responds.